Hi everyone. Now we are going to discuss about chickenpox. First, introduction. Chickenpox or varicella is a highly contagious viral infection caused by the varicella zoster virus. It is commonly affects children but can occur at any age. It is characterized by fever, tiredness and an itchy fluid-filled skin rash. The infection spreads mainly through airborne respiratory droplets and direct contact with the fluid from skin blisters. Vaccination is the most effective method of prevention. Next, we are going to discuss about the definition of chickenpox. Chickenpox is highly contagious viral disease caused by the virus named varicella zoster, characterized by fever and an itchy fluid-filled blister-like rash on the skin. Next, we are going to discuss about the etiology. Chickenpox is caused by the varicella zoster virus, which is also known as human herpes virus. It belongs to Herpes viridae family. The virus spreads through respiratory droplets from coughing or sneezing, direct contact with fluid filled from chickenpox blisters. It also spreads by airborne transmission. The incubation period is usually about 10 to 21 days. The next we are going to discuss about the transmission of chickenpox. Chickenpox is highly contagious and spreads from an infected person to another through airborne transmission by inhaling virus containing particles in the air, respiratory droplets through coughing, sneezing or close contact, direct contact touching the fluid from chickenpox blisters, mother to child transmission during pregnancy or around the time of delivery. A person is usually contagious from 1 to 2 days before the skin rashes appears until all the blisters have crusted over. The next we are going to discuss about the clinical features of chickenpox. Incubation period is about 10 to 21 days, usually 14 to 16 days. Prodromal symptoms, which is more common in older children and adults, they are mild to moderate fever, malaise, headache, loss of appetite and sore throat. The characteristic skin rashes also appears, begins on the face, scalp and trunk, then spreads to the limbs. Lesions appears in successive crops, so different stages are present simultaneously. Progressions, macules, papules and vesicles, pustules, crust and scabs. Rashes is intensely itchy. Next, we are going to discuss about the diagnosis of chickenpox. Chickenpox is usually diagnosed based on the clinical signs and symptoms. The clinical examinations, which includes characteristic itchy vesicular rash with lesions with different stages, macules, papules, vesicles, pustules and crusters. PCR test detects the varicella zoster virus from vesicular fluid or skin lesions. The most sensitive confirmatory test, direct fluorescent antibody DFA test, and detects VZS, that is varicella zoster virus antigen. Serological test detection of varicella zoster virus IgM and IgG antibodies. Viral culture, which is rarely used. The next we are going to discuss about the treatment of chickenpox. Rest and drink plenty of fluids is the most immediate treatment in chickenpox. The second one is paracetamol for fever and body pain, calamine lotion to reduce itching, antihistamines may be given for severe itching. Keep the skin clean and avoid scratching the blisters. Acyclovir and antiviral medicine may be prescribed in severe or high risk cases. Avoid aspirin, especially in children, and isolate the patient until all blisters have dried and crusted. Thank you.